The following is brought to you by Vertical Vet. Rethink your GPO.
Good morning, everyone. Welcome to our second coffee talk. Beside me, I have the lovely Katie Spence, who is somewhat new to the Vertical Vet team. She's been on for a few months. She has her MBA and she's a CVPM. This girl is crazy educated. We love having her on the team. I'm super stoked that she gets to join me today. And we are talking all things Pet Dental Health Month and how to make it a little bit easier on yourselves when you're running around like chickens with your heads cut off, missing lunches, and putting in overtime. And our hopes is by doing this with you guys today that we can hopefully avoid some of that this month and in future years to come. So please feel free. As you guys know, this is a new series for us. So if you have any questions and you want to pop them in the comments, someone from our team is standing by to answer these questions for you, and they are happy to hop on and give you anything that you need. And then with that being said, we will dive right in and talk about our coffee cups. So I went with the Panthers because Super Bowl is this weekend. I'm really sad that we're not going. And then also just hoping for better years ahead of us. And then Katie has her gorgeous mug.
Yes. So the big thing about my mug is that it is that big. Yes, I'm blessed to have 2 cups of coffee in 1 cup. So efficiency, because I don't have to go refill it again.
Yes. And so Katie and I actually sat down for this one and like really mapped out what it is that we feel is super important to talk about, because Pet Dental Health Month is huge in vet med. And honestly, so many practices run themselves into the ground each February, trying to make sure that they're seeing all these patients, that they're getting that discount in, and they're getting those clients convinced to be doing these cleanings. And so when Katie and I were running through this, we were like, how do we prep our support team for this to make sure that Pet Dental Health Month runs smoothly? And Katie had like the most amazing answer. So I'm going to let her run with that for a minute and let everyone kind of take it in. And as I said, please feel free to hop in questions because we're happy to answer them. And then also this gets us thinking for future videos as well.
Yes, exactly. So what I think is really important is making sure that you have enough support staff scheduled and your staff knows that you are planning for this, that they can see all these dentals piling up on the schedule. That creates some anxiety and uneasiness, especially when they don't know the plan. So maybe the staff meeting, immediately before that in the previous month or how often you have them, talk about what your plan is as far as scheduling goes, that you have enough staff to do the preoperative care and the postoperative care. They get the catheters placed, the pre-meds done, and everything's running smoothly. And the person who's doing the actual dental cleanings themselves are able to move from one patient to the other efficiently once they get cleaned up, and they're not having a lot of lag time in between. And that way they do have a better chance of getting their lunch and getting their break and not feeling as stressed like this is taking forever, because we're not being efficient in between. So that's very important. And then they also can rest easy knowing that their patients are being taken care of when they move from the surgery suite to recovery. They're not thinking about what's happening with them afterwards because they know that their team member is taking care of that.
Yeah. And you know what? It was ringing in my mind as you were saying all those things is communication. Communication is so key just in general, but especially during this time where you have 1,000 things moving in so many different directions. And if you're like so many of our member practices, they have several patients throughout the day that they're doing this with. And so knowing and ensuring that you have someone to take that patient and recover them and make sure that they're doing well and communicate that to the owner is incredibly important. And it ensures that your day is just moving seamlessly. And the other thing that we were talking about is, do you have that champion tech in your practice that can bang out dentals like no tomorrow? And are you not letting them share that knowledge because we're trying to stay efficient? And so we want to get these dentals going, but are you giving the other staff their time to shine and to grow and to get better at their x-rays and to be faster at cleaning the teeth? Or are you just running that champion tech in and saying, hey, we've got to knock these out. It's super important. This has to happen. And then no one else is getting that extra little bit of training. And it's something that I really think is important and that we should pay attention to, because how else are we going to grow our practice without growing our team members and ensuring that they can be dental rock stars themselves,
Yeah, I think that's one of the greatest challenges with dental care in general, especially when it comes down to dental x-rays. It takes a long time and a lot of training and effort to get those down in a short period of time. That was one of the struggles that I had in practice, was figuring that out. And so, if you have more than one person, then you're not this one person isn't shouldering everything. And you can spread that out throughout. So not everyone, not the same person is necessarily doing all the cleanings themselves. And that kind of goes into the next thing of client education as well, to help you be more efficient and educating your clients throughout the year about what their pet's teeth are supposed to look like, brushing their teeth, doing all of the things to get prepped for that. And then when it comes time for their dental, the other thing is to have an honest conversation about where their dental health is. Is their mouth a grade 3 or a grade 4, and it's probably going to need extractions? Maybe there's one that you can see that definitely needs to come out, or there might be one on the other side that you can't see. And so there may be multiple extractions. So when they come in for their dental and your team is talking to them about this, they're not surprised and they're prepared for the fact that this may be part of this procedure.
Yes, absolutely. And it all ties together. You know, if your team is talking to your clients annually about what their pet's mouth should look like and how we take care of them and how we care for that, when we tell our clients that it's time for them to do a dental cleaning, it shouldn't be just in February that we can convince them. It should be year round, because ultimately our clients want to do what's best for their dog or cat. And having a team that is super strong and educating them on those things and showing them what's right for their pet is incredibly important when it comes to making sure that these are scheduled appropriately and that the owner is taking the proper precautions. Ultimately, and you said this so many times, Katie, and in my mind, I was thinking, like, when you're talking extractions with a client, you want them to know, like, our end goal is that we don't call you with these. We want to call you and tell you that the cleaning went absolutely fabulous and your pet's doing great, and that, you know, they are fine to be picked up in a few hours, and that they don't have to eat soft food for the next few days because we took out a bunch of teeth. And Katie and I were talking about this too. So we're educating our clients, we're making sure our staff are educated. So when a pet does have to have an extraction, is your team prepared to be that person to call the client and have that educated conversation with them on what needs to come out and why, so that your veterinarian can keep doing the work in the back and doing what they need to do to keep those dentals pushing along, while your technician is taking care of that and feeling good and comfortable on the phone talking about dental disease and what that x-ray looked like and educating that client on why those teeth needed to come out. I know a lot of people do have their veterinarians do these calls. There's nothing wrong with that. It ultimately comes back to efficiency. So what is more efficient? Is it your technician who can be on the phone with the client while another is helping the doctor get prepped for those extractions? Or is it your doctor being on the phone during that time? It's ultimately what works for you. Every hospital is different, but what is it that's best going to fit the need and make sure that things are moving along smoothly? And that's really important, because a lot of technicians, and Katie can back me up on this, will bulk because they're like, oh, that's a lot of money and I don't want to call them and they're going to get mad. And ultimately they're not going to get mad, because if we're doing all these things, laying this proper foundation of talking to our clients about pet dental health, when you call to have this conversation, you're very educated and telling them this is what's best for your pet, then they should opt in to do it and not be you on the phone for 20 minutes trying to explain cost and things like that to them.
The other thing to think about that, Angel, too, is that, you know, I think one thing, if you talk to clients about this enough and they're well educated, when they come in and they check in for their dental cleaning, you can also broach the subject of extractions. They can have the option to opt in to have someone call them, but they need to understand that that will prolong the dental cleaning and prolong their pet being under anesthesia. So there will be a lot of clients that, if they've talked about this multiple times, or maybe they've had another pet that have had dental cleanings, and they know that you don't want to extract the teeth. We want to keep them if we can, but there's going to be times where they need to come out. And if that's absolutely necessary, they may say, okay, go ahead and do what you need to do. And you can talk to me about it when my pet's waking up in recovery. And you don't even have to have that stop and go type of scenario. So that's another thought too, is to give that option to clients at the time of check-in as well.
Yes, absolutely. I love that you made that comment. And it's like just as simple as putting a line item on their check-in sheet, guys, that says, I'm okay with not being called up to a certain dollar amount for my pet surgeries. And, you know, sometimes our doctors do know going into it, they're going to extract this much, so they can give them like a rough figure where a client could say, you know, up to 500, or you call me after that. And then that way you guys can go on and move right through your procedure. That was super smart. I don't know why I didn't even think about that, Katie. That's awesome. I love that you threw that out there.
It can definitely save you some time. And you, like I said, you will be surprised at the number of people that are like, okay, yeah.
Yes. And you know, guys, even the VV team, like we came on at the beginning of the month and we're like, what do our members want to know about Pet Dental Health Month? And then Katie was talking so extremely passionately about this. And it was something that I really loved. And it was talking about how, like, we don't have to kill ourselves during February. There's so many options that we can take to make things easier on us. And we did mention this yesterday in our Management Monday post, but I would love to have Katie chat with you all for a minute just about how we can take the stress off of our team and our clients too, right? Because we're trying to build everybody into a month and make it a little bit easier on you guys, which I love. So if you would touch on that, Katie, I would love to hear it.
Yeah, for sure. So, I mean, I think that one of the things we need to consider is, at the beginning, I'm talking about scheduling enough support staff. Well, how many of us have enough support staff? Like Angel said, we're doing overtime hours, we're doing this. It's really hard to find staff. And so instead of killing ourselves, I would be willing to guess that there's some clinics out there that have decided to forego dental month because they don't have the support staff and they don't want to kill themselves doing it. And so how can you handle that? I mean, one of the options is you could do it more than one time a year. Do you have another time, like in the fall when school starts, that you have a little bit of a downtick, that you might be able to put some dentals on there? Or, you can also do it year round. We're talking about this year round client education, year round staff education. What if you offer this dental discount so pet comes in for an exam, their routine wellness exam, or maybe another exam, and the doctor's taking a look at the mouth and says this, they could really benefit from a dental cleaning, and they've made that recommendation and they've graded that dental. And then you say, okay, well, if you book this within 3 months of the time that it was recommended, then you'll get the dental month discount or our dental health discount, whatever you might want to call it. And so that way you can spread it out throughout the year. You're still giving the clients this benefit. You're still talking to them about it, but you're not killing yourself trying to get it all done.
Yes. And I love that you said that because it can ultimately be a judgment call, right? Like if a practice is offering that all year, maybe you offer it to the younger patients that won't take as long under anesthesia and likely won't need extractions. And this can encourage like healthy mindsets for your clients when it comes to making sure that their pets are coming in frequently for their dental cleanings. So I love that you brought that up. And Katie made that comment, and this is something we would love to know is, are you guys postponing any dentals this year for Pet Dental Health Month? Are you just saying we're not going to participate this year? Or are you still trying to get your clients in through the door like normal? Because we know some of our practices have stopped even taking new clients. So we're like, how is this affecting you guys? How is Pet Dental Health Month feeling to you going into February with everyone having COVID like they have been and staff kind of coming out? What are your solutions to that? How are you guys persevering through and going into this month to try to get these teeth done? Or are you guys saying, no, for the mental health of my team and for the practice, we're just going to take a step back from it this year and see what happens? So I really think it's going to be interesting going into 2022, 2 years now into this pandemic, to see how everybody's handling things. And if I also would like to know, if you aren't bringing it back, are you going to ever bring it back? Or do you think my hospital is doing well enough right now that we don't even need to worry about it? So I'd really love to hear everyone's insight there and see kind of what you guys are doing and how it's growing your clinic and how it's affecting you. We would love to hear the feedback there.
Yeah, I definitely would love to hear the different ideas, because I feel like people come up with so many different things and ideas, and it's always great to hear, okay, well, this is what I did over here. That's what I did, and it worked really well. So I love hearing all those comments. I can't wait to read the comments.
Yes, same. And guys, there's so many things. No hospital is one size fits all. There are so many ways that you can restructure your Pet Dental Health Month. Katie is on board with our team. If you guys have questions, feel free to DM us. I would be happy to field them her way so that she can give you guys a little bit of advice or a little bit of structure to help with that. And then, as many of you know, I love all things dentistry. I'm always happy to talk about inefficiencies with your team. Anybody who might be struggling or having a hard time and their training is not doing as well as some of the others, I'm happy to give you some tips and tricks there. There's lots of things that you can do, guys, to help increase the efficiency in your practice. So please feel free to reach out to us, let us know, DM us, anything that you'd like to do to get a little bit more insight. And thanks for watching our coffee talk today.
Yes, thank you.
Thanks, Katie, for joining me. Bye.
Bye.